Do you really think it can be stopped?
I thought it was stopped when Scott Brown was elected.
Exactly right. That's what I'm saying.
Yeah, we thought it was stopped. We didn't think it was still going to be on the forefront. And now they're coming back in this manner. And I think it can be. I honestly think if people know what the true costs of this are, there's a lot of fiscal conservatives from both parties who feel that they can't afford more taxes. They can't afford anything like this on a national scale. And that's what the Scott Brown election showed us in Massachusetts, which was always seen as a very liberal Democratic state, and it turned very quickly. So I think that there is still time if people know what the true cost of this, passing this bill, is, what it's going to do to the American economy.
Help me out, guys. Help me out. What I said to the two congressmen just a few minutes ago is, if this is where the Republicans had us on immigration reform, and it was John McCain and Lindsey Graham here.
And George Bush.
And George Bush. You're exactly right. They had us right here. Yeah. Okay? They had us onto the center left, not the center right. Lindsey Graham and John McCain are still here. You can't, if this thing passes, you cannot pull this window back here. What you'll get is the compromise of moving the window here. You're going to need a Republican Party that is probably over here to be able to get it back to the center. Does that make sense? Because you got to, there's no way to, you can't cut this out. Once it passes, it's like in Massachusetts. It will always be there. It's just a compromise of that. Right?
I would make the argument that number one, that if it does pass, and I pray that it does not pass, that there's an opportunity for repeal.
Through the court system?
No, through the court, certainly. If they try this deeming idea, there's a huge risk for them, because there's a chance the court will strike down the whole bill. So that's number one. Number two, every Republican is going to run, an independent, Tea Party, they're going to run to repeal this bill. And a successful election in 2010 can stymie this bill from ever being implemented. This is a 2,700-page bill that if you look at and read the number of times, it says the Secretary shall, so the Secretary of Health is going to have to write literally tens, if not hundreds of thousands of pages of regulation.
You don't think that's already been written? You're fooling yourself.
Well, they can't.
The Center for American Progress. Look how fast that stimulus bill came out. I remember when that first stimulus bill came out, I said to my staff, "Who the hell's writing this? Yeah. Who's writing this? This isn't something they threw together. This has been worked on for a very long time." Center for American Progress. All that stuff is done.
My question too is, how do you read it? I can't read 2,000 pages in 3 days.
No.
I mean, maybe I'm a slow reader.
How do you have a president who says, "Well, I don't know what's in it right now, but it's got to be passed as soon as we'll read it for 3 days"? You can't. It's all legalese.
Well, the difference here is, though, when it comes to these regulations, there is a regulatory process that they have to go through, and it will take months, years.
Run by
them.
Cass Sunstein.
Well, I understand.
We had a rule in Massachusetts in our law that says if you lost a job, you had to wait 6 months to go to the connector for free health insurance. And that has not been enforced at all. So people are going immediately. So even the rules that are in place can be manipulated by the bureaucrats if they really want to bring people into full subsidized health care.
That's another thing that I don't hear anybody talking about, which is if this bill does pass, and as I believe me, it will take years to implement this bill and to get this thing off the ground. And the timelines in this bill are completely rosy. What's going to happen is Congress, I think, immediately after this bill passes, they've got to pass something called the doctor fix, which I know you've talked about, which is about $250 billion to pay doctors who won't see Medicare patients if you don't pay them more money, because they're going to get a 22% cut in their reimbursements. That's going to pass. The Democrats will not pay for it. President Obama will not pay for it. They'll recognize if they've passed this bill as is, they've got to do something to let people see something positive happen. So my guess is immediately they're going to start adding people to Medicaid. They're going to start adding people to the government program. Why? Because it's simple. You can do it very, very quickly. And that's what you did in Massachusetts.
Right, and that's what Nancy Pelosi is talking about. She said, if once we kick this door down, then you're going to see lots of legislation going through.
Yeah, we saw it. We're seeing it happen. Almost 100,000 people, in order to expand coverage, would dump right into Medicaid.
Well, this has been cheery. Thanks, guys. Counting on the American people again. Best of luck.
Thanks for having me.
I can't tell you how important these next 48 hours are.
I know.
Got to get out.
I know. America, we've been telling you know this, but you have to tell your friends, and if you're anywhere in the Washington, D.C. area, and if you're not, go to your local congressman's home office and plant your butt there and don't leave. Make sure they understand you have a very long memory and you will do everything you can to defeat them. Back in just a second.